So the first question we have for our panelists is something that has been brought up by multiple panelists. How does your respect for patient autonomy influence your view of AD dying? And in all fairness, we'll let Dr. Schneiderman begin.
Well, as you've already heard, I'm very much part of the group that thinks that patients live their lives, and today I understand those folks who want to leave their life in the hands of God. What I would like to ask, and this could be a good ISB research project, those of you who are opposed to AD dying or even euthanasia, how do you imagine you will die? Those of you who are in favor of it, how do you imagine you will die? I suspect we'll find significant differences, which is what influences us. And that would be a good study. Nobody has done it. We are couching this in moral terms, but I think there are psychology of how we feel about things. Comes out from childhood, upbringing, religious instruction. But I think that we come at this with different perspectives on something we don't like to think about, which is our death. Think about it. How do you imagine it will be? And then I think we'd be interested, I'd be very interested in what you find.
Regarding autonomy, I sit on our ethics committee at Mercy Hospital, and every case we discuss in terms of maximizing the patient's autonomy. First do no harm, and try to do things that help the patient. But patient autonomy really trumps almost everything else. But in that context, the patient has a right to refuse anything that we offer. If I say, well, you really ought to take this medicine, the patient can say, no, not interested. And they have that right to refuse. They have that right to refuse, CPR. They have the right to refuse a lot of things. But they have the right to make requests of physicians, but they don't have the right to expect that everything they request will be given. I mean, there's lots of examples. A common one is the patient comes in and has like a little viral cold and wants to have antibiotics. This is a common one that we run into. And it has a bad effect on herd immunity and some potential bad effects on that individual patient. But there are many examples of patients asking for things that they shouldn't have. And the patient has a right to refuse anything we suggest, but they don't have a right to expect to get whatever it is that they want. So that's kind of the fundamental ethical thing that we're dealing with. And it's kind of ironic in the sense of when we're talking about patient autonomy, because physician-assisted suicide is involving the physician in the process of allowing the patient to take their own life. But the Hemlock Society, now called Compassion and Choices, has been advising people how to successfully and painlessly kill themselves at home for decades. I had a patient 25 years ago that despite my suggestions to the contrary, went ahead and followed the suggestions of the Hemlock Society. So you don't really need to involve physicians in the process. There are ways that are painless and probably more reliable, really, than our prescriptions. So I think that that's an important thing to state in the context of autonomy.
So I think with respect to autonomy, it's super important, and I think that, for example, when Jerry Brown signed the bill, which, there was a chance he wasn't going to sign it, he didn't like the way they kind of made the end run around the usual process. But if you read his statement, it's very eloquent, hung it up on the internet, but essentially he said, look, I'm not saying I would or wouldn't do it, but I wouldn't deprive somebody of the opportunity to do it. And I think many of us, when we watched that story out of Oregon, thought, if I were in that girl's shoes or in that woman's shoes, I might be thinking that way, and I wouldn't want somebody to stop me from doing it. And when it comes to other ways of committing suicide, because anybody can stop eating and drinking, you're going to be gone in 10, 12 days. It's not terrible, right? But some people don't want to wait that time. They want something quick and easy. We're Americans. We want the quick fix. So there are other ways, but people may not want to use those other you go this route, it doesn't say suicide on your death certificate. There may have, other implications as far as life insurance and things like that. So, just another thing to think about.
I'll comment briefly. The pendulum has swung. Medicine 50 years ago was a Dr. knows best approach, very paternalistic, and we have seen the reaction to that very appropriately swing in favor of increased autonomy. But the consequence of that sometimes is that patients demand they're given things that aren't helpful, that are futile or wasteful resources or even harmful. And we as physicians have an obligation to engage the patient in decision making and in addition to their autonomy, their preferences, goals, and wishes. We also apply our experience to the circumstances, our training, and as professionals also give them a recommendation. Patients cannot just come and demand everything that they want from a physician. And we have no difficulty saying no to many patients in many other circumstances. And I think it is reasonable to say no to patients in this circumstance, providing an